Hi, I'm Dr. Bob Grakowski. Welcome to the Better Brain Academy and the moving modules. This is an overview of what we're going to be going over in this next series of videos, really designed for your exercise and for your movement. Just to give you a little bit of background on myself, I originally started my career in healthcare back in physical therapy. So when I first started, I dealt with head trauma, spinal cord trauma, cardiac and stroke rehab. So these are people that were paralyzed, had head trauma, or had a stroke, or post-heart attack. So my focus after working in physical therapy in a hospital setting for about 6 years was to go, why can't we prevent a lot of these things? So the challenge was a lot of people will wait until they have a serious condition. In fact, there's a Chinese proverb that says, he who lives the longest has a serious illness early in life, because you stay focused on it. And if you have something that affects your overall health, then you tend to focus on that and do everything you can possible. And it's important to understand how all the different phases of the Better Brain Academy are all intertwined. They're not just individual. You got to think right, you've got to eat right, you've got to get your adjustments so that the brain and the body have that neural connection. And you also have to make sure that you're moving your body. There's a lot of reasons why motion of the spine, movement of the body is so important for brain health. So I'm going to give you kind of an overview today, and then each of the videos will go a little bit more in depth and show you how to do certain aspects of the exercises. We'll start out with some of the more simple things and get a little bit more complex as we go through it. But these are things that you can do in the comfort of your own home. If you belong to a gym, there'll be things on that. If you like to exercise out in nature, there'll be things on that. The exercises are going to be looking at how to increase your energy, how to increase the detoxification of the body and increase the lymph system, increase heart health, increase strength, stamina, balance. All those things are going to be incorporated in this video series. So I'm happy that you're here for the Better Brain Academy, the movement modules. The other thing you want to look at is all the aspects. When you're exercising, it's really sometimes easier to eat better too, because you're going, okay, I'm taking all this time and energy to exercise, so you tend to eat better. So these go hand in hand with some of the things we've already covered in the eating modules. So this is an intro and overview. So a lot of patients are asking me right now, so what are you going to cover? Well, that's a pretty complex, just like we talked about initially. We started big and started to narrow it down in the nutritional factors. So we're going to talk about the one thing that is so important for our brain health. When you did your brain span testing, a couple of things that tied in with your cognitive flexibility, that means the ability to stay on one task but be able to move to another, your ability for memory, and your ability for sustained attention. All these things are tests that you can see different parts of the brain to see how it is functioning. Exercise is probably one of the best things for improving those scores. And a lot of people think, well, should I just go to the gym? What type of exercise should I do? Should I walk? Well, we're going to be addressing all of that. But what I want you to realize is that with science these days, you know, I've dealt with high-level athletes for many years, professional athletes in all different sports, to ultra-marathon runners, 100-mile Western State runners, professional baseball, NBA, football players, all of these that you're wanting that extra edge. So I'm going to give you the extra edge, and I'm going to put this in a weekly routine so you can actually incorporate things into your exercise routine so that you can improve this thing that is most important, called your brain-derived neurotrophic factor. So with science these days, they're actually finding, when I was in school, it was called axoplasmic flow. Now that's kind of a big word, which means there's this flow of energy along the nervous system. You can think about blood flowing red blood cells and the immune system throughout the body, and certain nutrients and things. But a lot of people don't realize that there are proteins that are made that flow along the nervous system. This flow of energy is so important. The axoplasmic flow, or the brain-derived neurotrophic factor, is a protein. It is formed inside the cell. So like we talked about initially, getting the cells healthier, the cell wall, the thing called the endoplasmic reticulum too many big words here, but just realize that inside the cell, you're making this brain-derived neurotrophic factor so that the hippocampus, which has a lot to do with your memory, short and long-term memory, the prefrontal cortex, which has to do with your executive level of the brain, and parts of your brain for your balance and proprioception, all need this brain-derived neurotrophic factor. How do you get that? Well, a lot of it is through intense exercise. You can get it through certain nutrients, reducing toxins, the things we've talked about so far, but we're going to be putting together the certain exercises and the certain things you're going to look at in the movement modules to increase this BDNF, as I will refer to it, or brain-derived neurotrophic factor. So this brain-derived neurotrophic factor is, in science these days, one of the key things that is the one link between so many different things, from dementia, Alzheimer's, Parkinson's, schizophrenia, obsessive compulsive disorders, bipolar syndromes. All these things are showing that if you do not have this BDNF, brain-derived neurotrophic factor, which is made by the body, then you can have a lot of neurological conditions, even epilepsy. So it's important to realize that exercises are the thing that actually make the difference in the making of this brain-derived neurotrophic factor. So we'll be addressing all those things. How can I address all of that in one time? You can't. That's why every week you're going to have a different video tying in with several factors that you want to put into play that week. The other thing that's important, we talk about the team approach, your thinking, your eating, your adjustments, and your movement. And as part of the academy, realize that you have the access to Janine's weekly meditation classes. Meditation is another huge factor in developing this brain-derived neurotrophic factor. So don't just sit back, engage. Use all the skills and the resources that we've put together. Make sure that if you've got questions, that you go to the Better Brain Academy Facebook page. You can ask questions there, and I've shot several videos in the first round just answering the questions, not only on that page, but as a video to make it more clear. So we're going to kick into the movement modules now. Glad you're here. Just realize that it's about movement. Maybe exercise was something that you just don't like to do. Well, just think you're going to move more. Sitting really affects the reduction of brain-derived neurotrophic factor, so make sure you're getting up from a seated position at least 45 minutes to an hour. Get the body moving, otherwise your brain gets stagnant. So it's time to move the body. Look forward to this training.